Welcome back to the Made to Mom podcast. I'm your host, Dr. Alexia Priolo, naturopathic doctor. On today's episode, I'll be discussing preeclampsia and if you should take aspirin during pregnancy. Now, this is a topic I see almost monthly on Facebook groups where someone is asking their group why their doctor prescribed them aspirin during pregnancy and if they really need to take it. The short answer is yes, take it. Preeclampsia is no joke. But let's spend the next few minutes diving into why, because that's often the root of the question. Why was this person prescribed aspirin and what exactly is preeclampsia? Now, before we really dive into that, you should know that pregnancy is a physiologic stress on the cardiovascular system as it undergoes many changes to accommodate the increase in blood volume and cardiac outputs. Preeclampsia is one of the hypertensive disorders of pregnancy, with most cases occurring in healthy women who have never been pregnant before and with no obvious risk factors. Preeclampsia is defined as gestational hypertension with the new finding of protein in the urine or one or more adverse conditions. Across Canada between 2012 to 2021, the prevalence of preeclampsia increased from 1.6% to 2.6%. And globally, preeclampsia occurs in 3 to 5% of pregnancies. Now, we're not quite sure why preeclampsia develops, but it's thought to start when the placenta's blood vessels don't develop normally. Now, this reduces blood flow and oxygen to the placenta, which can trigger inflammation and damage to blood vessels. The end result is high blood pressure and the risk of organs not getting enough blood. Now, aside from an increase in blood pressure, signs and symptoms indicative of preeclampsia include headache, abdominal pain, shortness of breath, or burning behind the sternum, nausea and vomiting, confusion, a heightened state of anxiety, and or visual disturbances such as oversensitivity to light, blurred vision, or seeing spots or auras. Now, a diagnosis of preeclampsia occurs when blood pressure is taken on at least two occasions after 5 minutes of rest, at least 15 minutes apart after 20 weeks gestation in someone who had previously normal blood pressure. The blood pressure target is a systolic reading of more than or equal to 140 millimeters of mercury, or a diastolic blood pressure of more than or equal to 90 millimeters of mercury. In addition to new onset proteinuria or one or more adverse conditions, which will be listed in the resources. Treating preeclampsia in pregnancy usually involves an antihypertensive, as there aren't any natural treatments to manage it. Giving birth usually solves the issue. Preeclampsia has many short term complications on maternal and fetal health. It may lead to high morbidity and mortality, intrauterine growth restriction, oligohydramnios, placental abruption, preterm birth, and stillbirth. Now, because preeclampsia is associated with a number of future health risks, including cardiovascular disease, we want to spend time with people in the first trimester to help identify their possible risk of developing preeclampsia. I found in my practice that the first few weeks of pregnancy is really uncharted territory. Now, this is when many pregnant people are kind of unsure of what to do until they meet their obstetrical care provider, which can sometimes happen, as far out as week 20. Now, ideally, we want to identify women at risk for preeclampsia early in pregnancy, ideally before 16 weeks gestation, so we can utilize aspirin as a tool to reduce the risk of developing preeclampsia. Clinical risk factors for preeclampsia can be identified early in pregnancy and are divided into high and moderate risk. Now, the full table is in the resources, but high risk factors include a prior diagnosis of preeclampsia, pregnancy, BMI of 30 or over, pre existing health conditions like chronic hypertension or autoimmune conditions, and the use of ART to become pregnant. So, this is using like IVF during pregnancy or to help with pregnancy. A moderate risk factor includes a prior stillbirth or fetal growth restriction, maternal age over 40, and a first pregnancy. Now, current management strategies to reduce the risk of preeclampsia include aspirin. Now, meta-analysis have showed a 53% reduction in relative risk for preeclampsia when aspirin is started between 12 to 16 weeks gestation among high-risk women. The American College of Obstetrics and Gynecology recommends that women with any one of the high risk factors or more than two moderate risk factors should begin taking aspirin, and these risk factors will be in the resource section. Now, supplementary calcium may also be used in combination with aspirin, as a recent systematic review and meta analysis show that calcium plus low dose aspirin appears to lower the odds of preeclampsia by about 80%. Now, while the SOGC guidelines state for all women vitamin D supplementation over and above Health Canada's recommendation for adults is not suggested to prevent preeclampsia, that said, a study demonstrated that vitamin D supplementation is associated with a 50% reduced risk of preeclampsia. And the World Health Organization recommends a vitamin D supplementation for women with a vitamin D deficiency prior to pregnancy to prevent preeclampsia. Do you know if you have a vitamin D deficiency? This is one of the blood tests that we do recommend prior to pregnancy or at least really early in the first trimester. Exercise is recommended for all women, especially those at increased risks and who are obese or overweight to prevent preeclampsia. Women who exercise between 60 to 150 minutes per week have 30% less risk of developing gestational hypertensive disorders, including gestational hypertension and preeclampsia. But exercise only reduced the risk of preeclampsia when women began exercise in the first trimester of pregnancy. Most importantly, once someone has been diagnosed with preeclampsia, exercise is contraindicated. In pregnancy, women who had a greater adherence to the Mediterranean diet style had more than 20% lower odds of developing preeclampsia. Now, thank you so much for listening to this episode of Preeclampsia. I hope you found it informative, and I hope you can understand why aspirin is utilized to help reduce the risk of preeclampsia, because this is a disorder or a condition that can have really great and far reaching impacts even past pregnancy and into the postpartum period and many years after as well. If you've been pregnant, did you utilize any of these tools to help reduce your risk of developing preeclampsia? Let us know in the comments. And if you found this episode helpful, please subscribe to this podcast or follow me on social media. I'll talk to you next time.